My name is Stella Iwuagwu. I'm the Executive Director of Center for the Right to Health. I am unable to be with you this afternoon because I am in the United States. I was in an accident in 2007 in September and fractured my back when I came home to collect data for my dissertation and supervise our Health on Wheels project. I was flown to Ghana thanks to all the wonderful people that made that happen, and from Ghana I was flown back to the United States for physical therapy, and I'm making good progress, and I'm with you in spirit, and I'm sending this video welcome speech. And here we go. The Special Assistant to the President on Millennium Development Goal, Mrs. Amina Ibrahim. The chair of today's event, my good friend, Dr. Chichi Aniagolu. The guest speaker, Dr. Bayo Adejumo. The Registrar and Secretary General of the Nigerian Nursing and Midwifery Council and co-host of today's event, Mrs. A.O. Olanikbeku. Members of the National Assembly here present, members of the Diplomatic Corps and international organizations, the Nigerian Civil Society, nursing and other medical professionals here present, all other protocols observed, distinguished ladies and gentlemen. Thank you for honoring our invitation to this year's Nigerian Nursing Excellence Award. This award was instituted last year to identify and honor Nigerian nurses who have demonstrated leadership in their various fields. Our hope is that this award will motivate nurses to continue their good work and inspire other nurses to walk the path of professional excellence. We are proud that the Nigerian Nursing and Midwifery Council is our partner and co-host of this year's event. The negative image of the Nigerian nurse is nothing new. Many of you have had first-hand encounter with unprofessional nurses. As a nurse, I was outraged by the way some of my colleagues treated patients. Recently, as a patient, following my accident, I watched in screeching anger and helplessness as my own colleagues treated me like a bag of rubbish no one wanted to deal with. These were some of the experiences of my clients too, especially those living with HIV/AIDS, that motivated me to found the Center for the Right to Health in 1999. We were aggressive in holding unprofessional nurses and other healthcare workers accountable, even as we educated and advocated for safe work environment. Since then, we've come to realize that in the midst of the rot that our healthcare system had become, there are awesome nurses. Nurses who have gone beyond the call of duty to provide quality care to patients in an environment that is physically, mentally, emotionally, and spiritually uninspiring, unsupportive. While others who could not bear it any longer migrated to greener pastures, those who stayed dealt with increasing workload. This award is meant to honor these nurses who continue to give their best. It is in tough times that the best come true. You are our heroes. How do we go about finding exceptional nurses? Thanks to widespread advertisement through print and electronic media, many nurses applied and were nominated. Following rigorous selection process by our impartial panel, we will today present you 5 nurses that have demonstrated professional excellence. It is important to note that we found many nurses, but due to funding constraints, we are only able to pick 5. Hopefully, your support in the future will help us sustain and increase the award. An addition to this year's event is the essay competition among nursing students. Our intention is to catch them early. Today you will hear the winning essay. Welcome to this award ceremony. I am grateful for your ongoing support to the center. I am also grateful for your prayers and donations towards my recovery. The best that I can do, the best way that I can say thank you is to continue to work hard in my physical therapy and be with you live next year. I am now able to stand on my walker and take a few steps, and I would like to share those few steps with you. Keep me in your prayers. Peace. Stella Iwuagwu. And here we take the steps.
Well done.
1, 2.
Okay.
Thank you. Thank you very much. Welcome.